to do the prevention of COVID through vaccine. And then I love it when we've got the whole idea here with Pinar, is that she represents this supply chain and therefore the vaccine distribution. So together from the understanding of the pandemic and through public health, and I loved how Dr. Fauci said those two primary areas. We're not only building up our public health institution and systems, but also the science and the research that will get us to the better understanding to have the facts to be able to prevent and or understand how to be prepared for whatever comes next. So we're going to ask them a couple of questions. I've told them all they're enthusiastic, quick, and punchy because they have the real essence of the hope for who we are as a community, and especially today with social courage. These three have evidenced it as well. So first, to you, Carlos, from your perspective, your vantage point, tell me what you think is going to happen relative to being prepared for the next, whatever the next is.
Well, I think the first thing, Anne, is we have to acknowledge that we failed in the response to this pandemic. And yet we thought we were prepared. We had pandemic plans. We had all sorts of things that, in a global security index, the U.S. was ranked as number one as being the country most prepared. And yet we have had the country with the biggest failure, right? We represent less than 5% of the world population. We're about 24% of cases and of deaths. So obviously we have to recognize that we failed. And then we need to see, well, why did we fail? What parts we were not able to prepare for? And the number one failure we had as a country was a failure of leadership. And because leadership is critical at a time of crisis, and everybody in the business community knows that. And when you don't have the right leader at a time of crisis, then you're going to fail. And unfortunately, you can't prepare for leadership. Leadership just happens when the pandemic occurs. So you can't say, well, let's plan my pandemic so it happens exactly when I have the leadership that I need. So then you say, well, what could we have done? Well, the second thing is we weakened those institutions that were there to respond when a pandemic happens. And that includes the CDC, that includes the FDA. And sidelining the CDC, in my mind, was particularly an egregious mistake because it was, first of all, it's personal. It's here in Atlanta. It's part of our community. These are our friends, our neighbors, but are people that we know. And we know the expertise and we know the value that CDC has as a global health agency. And to see CDC essentially be moved out of the response from very early on, in my mind, was clearly one of the greatest mistakes we made. And the third one is that we did not let science guide the response. We let politics guide the response. And as Dr. Jim Curran says, public health has always been political. Politics is part of what we do. But it has never been partisan. And in my wildest dreams, I would have never dreamt that a face mask would become a political symbol. That a vaccine today, people are talking about whether there's more, hesitancy in Republicans or here or there. I mean, this doesn't make any sense. So making public health partisan, I think we made things that are technical political. And by doing that, I think we weaken our response. And then the last thing that I think we failed, and something we really need to think about as a country, is that our nation, our health system, our public health is typically run at the state level. You cannot run a pandemic response at a state level. This is a little bit like trying to run a war. You will not go to war and tell every state, well, you recruit your own soldiers, you get your own things, and then we'll meet you up in whatever, Europe or wherever we're going to fight. Because, we'll get there and see what we can do. We would have never won the Second World War had we done that. Here's the Georgia Army, here's the Massachusetts Army, and that's not how a country responds. And having had 50 different response plans throughout this pandemic, I think was a major problem. So the question really, the difficult question is at what point in time do you have a national strategy supersede, and we're living right now. I mean, the pandemic, the response to the vaccination is a mess. And it's a mess because every state has different requirements. Every state has different responses. There's not a national plan. So I think at some point in time, we're going to have to look at those issues, because if not, we will fail again in the next pandemic.
I love it. It's that whole leadership thread with the expertise, the science, and then the execution. So I love it. So thank you very much, because that leads us to Joshua as we talk about testing and so beautifully looking at community implementation. What do you see?
Well, we learned a lot from this pandemic, and some of what we learned is that we had to build things on the fly. And so in thinking about where we are now, and it's important to keep in mind, we're not done. And I think that's going to be a theme we heard partly today. Yes, we are moving towards, hopefully, an end game, but we can't give up those things that have eventually been shown to work, like masking and distancing and testing as part of an integrative approach to keep cases down, even as we get immunity the right way, the safe way, through vaccines. So when we look forward, I think that investment of the things that have worked have got to be in place earlier. And if we're going to reason given uncertainty, because what happens often early is we have to make decisions using limited data, but then the data is key. And if I go back in time about a year prior to now, some of the earliest understanding of person-to-person transmission was because of genomic surveillance data that allowed us to see clusters that were not coming, let's say, from an environmental source, but had the same signatures of individuals who had no connection to that source, indicating we have a human-to-human issue at hand. Without that surveillance, we would have even been farther behind. So once we get those sort of surveillance systems in place, then we can start to see the value of more information. Testing people is not something that is a passive activity. What we've shown, and many other institutions have shown, is that testing can be a form of active mitigation. That not only are we getting data, that it's becoming part of decision support systems. And so I guess the last thought I would have with respect to the next, which is still now plus the next, which is to really think about infrastructure development, both because we need to support basic science and principle development, but also because we need to reinvest in things like a national forecasting center. And not because we want that forecasting center to tell us the bad news, and then the bad news comes and hits us, but because that supports new actions that we could be taking, and eventually that's going to have to connect to community scales, because the community partners are going to be essential if we're going to take those principles, turn them into tools, and then eventually turn them into action.
But I love here again the thread between Carlos and you is that you still have to, what we know is what we know today, and building on that in terms of the long-term leadership. And it's also between the two of you, it's the sort of the think global, but it still has to act locally in terms of the communities in which those partnerships exist. And yet we need a national plan, directive, perfect. Because, right, Pinar, once we have a plan, we have to have it distributed. So let's hear a little bit about, from your perspective, on that whole supply chain and vaccine distribution when we have a plan, right?
So the first thing I would like to mention is that we really need to rethink the design of our healthcare systems. The pandemic highlighted the vulnerabilities, the gaps in those systems. They have been operating at fairly high capacity even before the pandemic, because that's how they were designed. High utilization, minimized cost. And they were designed for the most part for sick care, not for healthcare, in part because of the financial incentives in place. So as we rethink, it's really important for us to redesign, rethink our healthcare systems to focus on promoting health, supporting healthy behaviors, putting incentives in place for healthy behaviors. So really shifting the focus from the sick care to healthcare. The second thing I think the pandemic highlighted, this was mentioned by my co-panelists as well as by Dr. Fauci and Walensky, is the disparities. We have seen disparities, very, very glaringly in health outcomes, hospitalizations, deaths, as well as infections in people of color, much higher than other communities. So as we rethink the design of our healthcare systems, it's very important for us to also make sure that we have access and equity to everyone, regardless of their background, color, where they live, so that we can have a more equitable access to these services and healthier communities. So supply chains, again, the vulnerabilities in health supply chains, medical supply chains, pharmaceutical supply chains, we've seen lots of issues during the pandemic. So it's very important for us to first and foremost have the information, the vital information that we need, so we understand what do we have where, what do we need, so that we can actually bring the demand and supply together, especially during a crisis. It's very difficult to do this on the fly, so you really need to have many of these in place ahead of time so that you are ready when the crisis hits. And then the final thing that I would like to mention is the importance of collaboration and coordination between different organizations, whether it's government, private sector, NGOs, academia. And it's important to establish these collaborations, different roles, connections ahead of time, because again, this is very difficult to establish during a crisis situation. So our nation has been the leader in science technology, but we failed in coming together, bringing things together, and mobilizing our resources for effective COVID-19 response. So for future, I think this is another very important aspect for us to have these connections and different pieces together. So when the crisis comes, people know what they need to do, where, when, so that we can respond in an efficient and effective fashion.
What a difference a year makes, from the point of all the unknowns and y'all putting it together. And for those of us who were sitting in our homes on March 13th, oh, this will be done in 2 weeks, we'll be ready. And what we've seen over time, and we talk about literally what a difference a year makes, and of course Dr. Fauci mentioned that, is that today there's much more intention, there's focus, crossing the silos, collaboratives between the public and the not-for-profit, the NGOs, as well as the organizations like CDC and the Carter Center, is to bringing them together to focus on how we move forward instead of all scrambling. So I love that. Thank you, Pinar. And I think that's where so much of the difference in the year, back to leadership, focus, intention, resource allocation, and new ways of communicating, that will be critical. Because what I think is, if we look at not only how you prepare for the future, is where do we see bright spots, whether it's domestically or globally, that can make us think, oh, there is hope. There's some optimism out there, other than the difference in a year. And Pinar, I'm going to start with you this time. Where do you see hope?
Some organizations have done a good job in making sure that they operate safely, bring back their communities safely. I think Georgia Tech has been one of those bright spots. Like Dr. Cabrera, President Cabrera mentioned earlier, we don't have a public health school, we don't have a medical school, but we were able to implement testing, tracing, isolation, and now vaccination. All of this is happening on campus. And I think the leadership on campus has been key in making this happen, as well as the participation from everyone on campus, commitment from everyone on campus, students, faculty, staff, leadership. I think the way the leadership communicated openly to the community, broader community, as well as received input from various constituents within our community, I think that has been key. One of the reasons I love being at Georgia Tech and why I came to Georgia Tech is because of the collaborative spirit here. And I think this collaborative spirit shined probably like never before, with so many of us coming together during this time of crisis. And I hope this gives hope and sets a nice example for others as well.
That is so cool. I love that story. And President Cabrera, you mentioned it, where you said, well, we've never done it, but we'll do it. We'll do it. Let's do it. We'll just get it done, bring everybody to the table and get it done. So I think that spirit, the Georgia Tech way, needs to be expanded across many campuses as well as across the country. The collaborative, yes, out of our comfort zone, like Dr. Walensky said, out of our comfort zone, we'll manage. Move on. So tell us, when you were talking about Joshua, your partner in crime here, where do you see hope?
don't want to steal Carlos's thunder by saying vaccines. Can I say vaccines?
Is he Hope right here? Hope is sitting right next to us.
Obviously, I am deeply optimistic about the change of direction here because of the widespread availability of highly effective vaccines. I think that should bring all of us enormous hope and optimism. Now, with respect to lessons learned, now the negative there would be we give up on the other items as those become available. So what has been a bright spot to me in this past 6 to 9 months is precisely the way in which community members have come together, often with very disparate expertise. So I want to be clear, I'm sitting up here with colleagues today. There is a very large team, my colleague Greg Gibson in particular, on the laboratory side, logistics folks who have figured out much more effectively than having me as your technician trying to figure out a way to make a saliva-based sampling testing system fast and efficient and easy. A whole team of folks from communications to logistics to scientists who've come together in common purpose, in a sense of service, of trying to serve the community, inform the community, sometimes tell them when things are not going so well, that we have to, even when things are going well, we have to be aware that that may not be the case a few weeks from now and that we have to remain vigilant. I think those kind of interactions and collaborations can be the basis for improvements in the future, whether it's because we're going to be better prepared or even take that same collaborative spirit and develop a new technology in advance or system in advance, or even be more ready to communicate at scale. Like this question of communicating risk in a different way so that people can take their own health into their own hands and try to make more informed choices. But going back to my first point, all of this now with respect to getting us through this non-pharmaceutical route, obviously, all of the investment that was done very early, whether it's Moderna or Pfizer or J&J, are putting us in a much better place right now than we were even just a few months ago.
This is both inspiring and informative. Thank you, Joshua, so much. I'm thinking about the story Dr. Fauci said about every single person in the scientific community has a part to play. They may think their part is very small, but in the big scheme, if we didn't have it, we wouldn't get where we are. So I love how you're talking about the team approach, the trusted approach, and how you communicate it. Okay, Dr. Del Rio. Now he's Dr. Del Rio.
So what is the? What are the bright spots? To me, the one bright spot and one we need to emphasize is the value and the triumph of science and of research. It is the investment in research that has gotten us vaccines and has gotten us to where we are. And I think the U.S. spends a fair amount of percentage of GDP in research through the NIH and through National Science Foundation, et cetera. And frequently you hear politicians say, well, why? What do we get out of this? Well, we get the kind of things like the vaccine we have right now. And I think telling the story about how supporting basic research actually has tremendous implications to where we are. So I think that a bright spot has been that the investment of years in research has paid off, and I think has gotten us to a much better place. The second thing is I think that a bright spot has been the response of thousands of humans around the world. And I talk about many people, but I want to refer right now to healthcare workers, who have been there in a very difficult circumstance, and now for a year taking care of sick people, and frankly being tired and exhausted. And it's been really, really hard when you have people coming in that you have not much you can do once they get really sick, and 5, 6, 7% of them are still dying in the hospital. And it makes me think about the Dr. Jonathan Mann, who was the director of the Global Program on AIDS many years ago, at an international AIDS conference, he said back in 1998, he said, when the history of AIDS is written, our biggest contribution may be that at the time of plague, we did not flee, we did not hide, we did not separate. And I think the fact that people could have walked away and say, look, I don't need this job. I don't need to put myself at risk. I'd go somewhere else. Because there have been thousands of healthcare workers around the world who have gotten infected, and people are still taking care of individuals. And I think, the human condition, compassion, caring, has really been prominent throughout this pandemic. And I think, again, we need to think about how do we capitalize on that? How do we get away from our individualistic selves and really move into a more, sort of community approach to, because what Pinar was saying about health disparities, health disparities are in great part, as Dr. Fauci said, the result of social inequalities and things that are happening in our society that we need to start caring about: housing, education, food, access, many things that have nothing to do with healthcare, but have everything to do with health. So thinking about how do we address some of those things, I think could potentially be some of the positive bright sides of this pandemic, is that we may eventually, I think, come out of this really taking equity and justice as a much more serious thing than we've done up to now.
And amen to that, as Dr. Fauci was even talking about the bright light, the shining the light on the entire community, which is a part of a health story. Whether you have the house in which to safely live, the food to remain your health, to be able to say, I began to get educated. So the whole community is so much a part of positive health, as well as access to good health care. And I love how you said, obviously, as you heard from President Cabrera, I came from IBM, and we were one of the largest research investors in the world. And to be able to know that kind of research and patents and creative and innovative brains were working, because that's what I loved about the work that was happening in the research arena, where Kizzy Corbett was right there, having worked on this with many of you over decades. Well, not she's young, but I mean, the work that had been going on for decades, and it comes to fruition in times of need. So that's a part of that bright spot. But Carlos, you just mentioned a lot about why we're here: social courage. And for many of us, we've seen that in the face of the health workers, the people who were taking care of the children of the health workers, the parents who've been at home during this time doing homeschooling, which is not an easy job. I'd love for you all to think about that. And where have you seen social courage within either yourself or others? And how did it impacted you, especially in light of the celebration today of, as I love Dr. Fauci, not just him, but all those that have been a part of this journey for the last year, and actually, as we've heard, for decades. Carlos, would you like to answer that or respond to that?
I mean, I think you think about, there's been many people that have talked about courage and the importance of courage, but I think about, Winston Churchill and others. Courage is not the absence of fear. Courage is really the ability to do the right thing in difficult circumstances, right? And I think throughout this pandemic, you can put, countless examples of people who have done exactly that, who have not remained quiet, who have worked very hard, who have stepped out of the comfort zone in order to do the right thing and work together across institutions, across nations, across communities, doing what needs to be done to address the pandemic. And that, I think, to me, is what the courage that we need. And we need more of that in our society, because I worry that again, people are beginning to say, well, this is over. When are we going to get back to the way things were? When are we going to get back to normal? And I tell people, we don't want to go back to the normal that we lived at. We want to go forward in a much better normal. And that's going to take courage to do that. It's going to take courage to be disruptive and to be different. And I think we're going to have to disrupt higher education. We're here in this, campus of Georgia Tech. I mean, how are we going to change our education going forward? What have we learned out of this pandemic? What can we do to make access to education more affordable and better to everybody, as opposed to a few individuals? So I think using the pandemic as a way to really leap forward and get us to a better place is going to take enormous courage. And I think that all of us need to think about, how do we do that?
The whole new word is reimagining and a go-forward strategy. We don't have to just go back. It's to go forward. Thank you, thank you, thank you. Joshua, what have you been thinking about courage, social courage?
I think Dr. Fauci expressed it succinctly, which is that sometimes courage can mean telling the truth, speaking the science, telling the facts, however inconvenient. And about a year ago, a little bit more than a year ago today, we hosted a rapid response forum at Georgia Tech in early February. And one of the speakers was Trevor Bedford. Now, some of you may know him. He's a genomic epidemiologist, in some sense, someone who does detective work by looking at sequences of viruses and trying to understand origins. And he described seeing this pattern that seemed to indicate human-to-human transmission, and then spending all the time he could telling as many as people as possible. And then making a strategic decision to go spend much more of his time. He's a basic scientist, using a platform that really he had developed and was ready for this moment called NextString, to spend the time communicating and sharing exactly how severe this could be and how much action was needed. And so I think that's an example. It's a different kind of bravery, you might say, but in the realm of science, this absolutely was that kind of decision, strategic decision to pursue evidence and truth and share it, even if it's inconvenient. And I think that kind of courage is infectious, let me say in a positive sense, meaning when I saw that, and I had seen his work on NextString, and I thought, a few years ago, why is he making websites? And then when I saw it a year ago, I said, I know why he's making, why aren't I doing more of that? Why aren't others doing more things like that of translating? And we made strategic decisions here with a colleague, Cleo Andrus, in design and computing, to try to take elements of risk that we felt were understandable, but then turn it into a tool that others could access, democratizing access to information in a way that people can make a decision. Is it actually risky to go in that crowd of 20 or 50? It was hard to make those sort of tangible decisions. So I think in that sense, that began to spread not just to me and my team, but to others in the team. And you can start to realize that that opportunity, it's challenging. But how do we go outside our academic circles and really bring that out to the community? And that comes with risk, but it comes with real opportunities to make a bigger difference.
Brilliant, because I think that's what so often people are hesitant to get out of their comfort zone, take the risk, ask the question, develop the idea with the intent or the fear. Fear often reigns in terms of giving us not as much confidence to take the risk. So I love hearing that, is that taking the risk and then having the application, a ripple effect. Brilliant. Thanks, Joshua. Pinar, what are you thinking about social courage and what effect it has on you?
I mean, just to add a different perspective to my colleagues, I think about every single person in this country, in the world, during the pandemic, all the difficulties they are going through. It takes courage to wake up every day, to put one foot in front of the other and to keep going. In the US, we lost about 500,000 people to COVID. That's a huge number. That's about the population of the city of Atlanta. Imagine an entire city wiped out. Probably each and every one of us lost a friend, a loved one, a family member, or know someone who did. So it's been really difficult for, I think, every single person. On the personal side, I would like to acknowledge my students, my graduate students in particular, the courage it took to them to stop what else they were doing and work day and night, especially during the early months, non-stop on COVID-related research because they cared and they wanted to make an impact. And, from our Georgia Tech community, again, earlier in the pandemic, there was a time when we thought that some of the guidance that we were receiving from higher level organizations was not exactly sufficient for us to maintain safety on campus and to bring people back to campus. And a group of faculty members got together following science, a lot of deliberation, wrote a statement basically saying we need to do things a little bit differently than what we are hearing to establish and ensure physical distancing, for example. So we need more flexibility in our modes of teaching, and we need masks on campus. This was at a time when masks were not required or mandated, but we thought we really needed masks to make this a safe place. So it took courage for that group to come together, to speak up, and to be proactive rather than reactive to ensure safety and health and well-being of the population.
Oh, I think, unfortunately, our time is up, but you have heard three voices of courage who understand what it means from a global perspective of the folks affected and impacted by this COVID, but also the work that each of them have done over time. And to you, we're so grateful because it does exhibit the at-home real people that do courageous things every day. And to you, Carlos and Joshua and Pinar, I am so grateful and humbled to be on the stage with you and President Cabrera for letting us be on this stage to celebrate not just Dr. Fauci, but the brave souls who are working every day in community to be prepared for that next pandemic. Thank you, thank you, thank you. You all are my hero sheroes. Thank you so much. President Cabrera.
Well, let me add my appreciation to you and for moderating the panel, to the three of you. Not just for obviously for this incredibly interesting and insightful conversation, but most importantly for what you have been doing this year. And I think all of you mentioned it, and I do recognize that there's a lot of people behind you and in other groups and throughout Georgia Tech and throughout universities around the country. But I am grateful to everyone, each one of you. And let this moment be a reminder to all of us of what an incredibly important function we have as universities dedicated to research, to educating new generations. Think about it, there's no other institution in our society that can do the kinds of things that we are called to do. And let this be a reminder that it's not always easy, it's not always pleasant, but it's absolutely essential that we deliver on our mission. Thank you all very much for being with us today. Much appreciated.
Yeah. Well, he asked for it. Yeah, he asked for the pin, so that's a little. Yeah, those pins here. Thank you for coming. Are you based here in Atlanta? Yeah. What types of things do you typically cover? Gosh, if it has been nice not to have to do that for a while, or is that still on your radar?
No, I mean, once the inauguration happened in January, we got into that quite a bit.
Yeah.
But, it's still a part of what we do every day.
Sure. It's everything. Eyes are still on Georgia right now.
Exactly.
Yeah. Well, we appreciate you coming, and if there's ever anything like Siobhan and Ayana are part of our media team, and feel free to reach out to us if you ever need anything. We can help with anything.
It was great meeting you all.
Yeah, good to meet you too.